Welcome to this episode of Healthy Conversations, brought to you by Athens Limestone Hospital, where we connect you with the trusted healthcare professionals to keep you informed, empowered, and well. I'm Susan Claiborne, joined by Karina Farr, and today we're diving into the questions many of us ask in the summer month. Is this a summer cold or something more? We're joined by Tiffany Comer, certified registered nurse practitioner with Tanner Community Clinic, to help us sort through the signs and symptoms of viral illnesses versus bacterial infections. This episode is full of practical tips to help you and your family stay healthy all summer long. Tiffany, thank you for coming to join us today. I know you had to make room in your patient schedule to be here, so we appreciate that.
Yes, ma'am.
But just to start off, just tell us a little bit about yourself, kind of how you got into healthcare and why you became a nurse practitioner.
All right. Well, at 12 years old, my mother worked at a long-term care facility. So every other weekend, I would go with her. So I got to get to know, the nurses, see their routine, got to help with activities, just to be at the long-term care facility. So, later on, 6 years down the line, I became a CNA at that same long-term care facility. Went on to do my LPN, my RN, and then my nurse practitioner, I went on and got it. And the reason why I wanted to be a nurse practitioner is to help people diagnose, treat different illnesses, just primary care, just be their primary care physician, somebody that they could trust, answer their questions, and just, help them every day.
Okay. Well, that's a neat path. I mean, we talk on here with different professionals and kind of how they got to where they are, and everybody's story is so unique. And we certainly haven't spoken with anybody who had that story starting through long-term care with your mom and kind of all the way through. So that's very, very neat. So you were out at Tanner Community Care.
Yes, ma'am.
Okay. So today we're kind of going to talk about summer colds. I know I've already had one, and you kind of think that in the summer you're not supposed to get sick. You're supposed to, that's supposed to be that winter kind of thing. So kind of what are you seeing?
Strep, I know hand, foot, and mouth. I've talked to several other, of my friends that are nurse practitioners. Stomach viruses. All these kids are out of school. They're playing with their neighbors. Everybody's going on vacation. They're playing with cousins. So, a lot of those things that we see during the school year are still continuing on. So, those are the big things. Even some COVID. So I haven't seen flu. It's kind of, went back to the wayside, but definitely you could see all of those right now.
Yeah, I mean, you say people talk about, just a virus. Can you explain the difference between a viral illness and a bacterial infection in everyday terms? Something you would talk to a patient about?
Yeah, so both of them are contagious, and a lot of it is the patient. When they come in, you want to know their symptoms, how long it's lasted, and the physical exam. So, it boils down to those two things. So with bacterial, with strep, you're going to see the patches in the back of the throat. They're going to have the fevers, the body aches, the chills. If it's viral, it may last up to 2 weeks, get better over time. Bacterial doesn't seem like it's getting, better. It needs something to help. It needs something to kill that pathogen. So, a lot of times it's just talking to the patient and symptom treatment and stuff. So.
Yeah, we like to kind of think that a steroid pack or a antibiotic or something will kick everything, and it's kind of frustrating when you go to the doctor and they're just like, no,
just take your
antihistamines, rest. And your antihistamines. So there's nothing worse than that coming on you about 6, 7, 8 o'clock at night, and you realize that you don't have anything left in the cabinet.
Yeah.
I've had that happen recently too.
Oh yeah.
So can something viral turn into something bacterial, or are those separate things?
Absolutely. So say it starts off with a cold, but then, you start having that ear pain or that throat pain, that stuff that builds up in the back of the throat. So, what the ear pain, you come into the clinic, we look at your ears and, they're cloudy, they're red. So now we're dealing with an infection. Now we need an antibiotic on that. So they very well can. And especially over time, say something viral, it kind of gets better, in 7 to 10 days, but something bacterial, doesn't. You're throwing everything that you can at it and nothing seems, like it's helping. So at that point, it's time to see someone. Yep. Need an antibiotic.
Well, I think as a mom, we got to go through that strep throat phase with our kids fairly often. And I remember my pediatrician, obviously, it's been years ago, and it was one of those of how do you tell the difference between whether you have strep throat or whether you have a sore throat from a cold?
Right, right. So, it's the symptoms. If a child, they're not eating, they're not drinking, they say, it feels like I'm swallowing glass. I get that from a lot of patients. They're like, I can't even swallow my saliva because my throat's hurting so bad. So, and then, me looking where the exudate or the white patches are located. Because you can have the drainage, you can look in someone's throat and see the thick drainage that's going down. So both of them can cause soreness. It's just, where it's located and what it presents in the physical exam in the clinic.
And you were saying stuff in the summer, the reason it might pick up, like going on vacation. So I was saying earlier, it's kind of pertinent to me because I'm going out of town next week. I'm flying with my toddler and going on a plane and a new place and everything. How would you suggest families to prepare for going out of town and possible sickness?
Oh, yeah. So just like me, we just got back from the beach, so I bring a little bit of everything. I plan ahead, like Benadryl for any kind of allergic reactions, your antihistamines, Tylenol, ibuprofen, those kind of things. Making sure you're bringing your daily vitamins. Washing your hands, and bringing that sanitizer to the table and, just those precautions, just having that on hand.
Yeah, we were just talking about, flying is a little different too, because, you're kind of in a closer quarters and, of course, all the numbers of people going through the airport. So, vitamin C, does that really help?
Well, there is studies that show that it does. It definitely can, I don't think it would hurt to take vitamin C. So, yeah, it's in your multivitamins. Yes, I'm a big believer in vitamin C. I, too, either drink orange juice every day or I'm doing some kind of form of vitamin C, a gummy, a jelly bean, something like that. So, yes, especially this time of the year.
But I guess washing your hands is kind of that primary.
Yes,
Don't touch your face. And
I never realized how much I touch my face until I think about it.
Yes,
Especially last time I traveled on a plane, I was really focused on not getting sick because I feel like I always get sick on planes.
Yeah.
So it was in the front of my mind, and then I kept realizing how many times I subconsciously touched my face or rubbed my eyes, or I was like, this is probably why I get sick on the plane every time. It's a hard habit.
Yeah.
And with children, you can't keep their hands out of their mouth.
Yeah, because they're, before you know it, they've picked up something, it's in their mouth, and you're like,
and they're touching everything. They touch everything. Yeah.
Yes, they do. And that's, everything's contagious, viral or, bacterial. So that's how, things get spread is, sneezing and touching a surface that somebody had sneezed on and, doorknobs and all that kind of stuff. So easy to catch everything.
So I just need to put them in a bubble.
Yeah.
While we travel, just
right. For the time being.
You're not allowed to touch the ground. You're not allowed to touch anything.
No. And like I said, you'd think the summer is the month where, you're not going to catch a cold as easily, but I've already had my summer cold.
Yes.
So what are some red flags, like when do people need to come to the doctor? What are some things to look for, if you've, I guess, maybe tried treating at home, or what's your advice for that?
So, if it's been longer than 5 days and you've threw everything at it, it's time to get it checked out, antibiotics on board, steroids, the cough's not getting any better, you have COPD, asthma, you're prone to bronchitis, pneumonia, it's definitely time to get it seen about. Oh, yeah.
Yeah, and I know some people, like you're saying, being prone to it. I know I have a friend who it seems like anytime she gets sick, it pretty much goes straight to her chest. Mm-hmm. So I know she's one that really has to treat it aggressively kind of from the beginning. So people do need to be aware of their bodies. And
absolutely, and trust it, and, I don't never think, why is that patient here, because, their body's telling them something, so go see your doctor for sure.
What are those things that you kind of make sure are in your medicine cabinet? And the reason I ask is recently I was going to get, like I said, the summer cold.
Yeah.
And I noticed that the medication has changed so much in the last several years. You know, like when Mucinex used to come out, you had like 2 or 3, but you had all these Tylenol colds, Tylenol severe cold, things like that. And I was kind of looking for something specifically more like sinus cold related. And it was like there was 24 different versions of Mucinex, and there was 2 boxes of Tylenol cold or options. So I've kind of found that interesting. So what do you kind of recommend kind of keeping in the cabinet?
Benadryl, you know, just for those serious allergy reactions and stuff, but antihistamines, decongestants are the big 2 things. You know, with sinus infections, you're going to have that, you know, facial pain, that decongestant. Anytime you take a decongestant, antihistamine, it'll help dry up, you know, the fluid, release some of that facial pressure, keep that stuff from going back to those ears and setting up an infection. So definitely in my cabinet, I keep a decongestant and antihistamine at all times. Tylenol, ibuprofen for, you know, the headaches or the facial pressure too. So, yeah.
I notice when I take those, I definitely have to increase my water, it feels like.
They tend to have a drying effect. They do, and it affects all aspects of the body. So, yeah, anytime you take an antihistamine, decongestant, increase your fluid intake of water. Yes.
Okay.
And besides things like traveling and being new places in the summer, are there environmental things, maybe local to our area, that are affecting people?
Yes, I see it a lot in the tanner community because there is a lot of farming. You know, like we talked earlier, you know, they're kicking up this dirt, they're plowing these fields, you know, so it's real, you know, you see clouds of dust. So, you know, there is different things that live, funguses and things that live in the dirt that, you know, can cause people to be sick too. So they get in your airway, they cause, you know, drying out. You hear people saying, you know, it's just dry, you know, and of course the humidity. We have you know, in the South, the humidity is terrible. And so that adds to it too. So someone that has trouble breathing already, when the humidity and this dust and everything, you know, it causes a lot of, problems for them breathing wise. You know, they have to use their inhalers more often this time of the year because of, you know, seasonal.
And it's been so wet. The humidity is just going to be worse this year than ever before, I would suspect.
Yes.
And you've also had a lot of road work going on out there.
We have. Yes, a lot of asphalt being put down, a lot of chemicals in the air.
Those irritants. Because the chemicals in the air, you can just smell asphalt.
Yes.
It just is not a good smell.
Yeah. Tanner is just a big farming community, so, you know, we see that a lot.
Yeah. There's just a lot going on out there.
There it is.
So, at the community clinic, you don't have to have an appointment necessarily I know you can make an appointment, but you don't have to have one.
Right. We do take walk-ins, you know, and we try, if we can't see you right then, we'll give you an appointment that same day. We do welcome walk-ins. You know, I see, a lot of times I'll have people scheduled, but my days pertain to a lot of walk-ins, you know, and so, we'll get you in there.
So, what do you like about working at Tanner Community Clinic, or the community clinic in itself is very different than being a nurse practitioner at the hospital?
It is. Well, you know, Tanner's a small community, or to me it is, you know, and I see in the clinic lots of generations. Like I'll see mother-in-laws, sisters, brothers, kids, cousins. I mean, it's a lot of generations there. You know, so I see a lot of families, and I really like that, you know. So, yeah.
What brought you there?
I have always wanted, you know, I previously worked at the health department, so I was in that area. I did some precepting also at the other Tanner clinic when I was in nurse practitioner school, and just the small feel. You know, I grew up in a small hometown too, just that small feel. So, but yeah.
And it gives you that opportunity to know the patients. Not just their medical, but their personal too, which obviously sometimes impacts their medical care.
Right. Yeah.
So is it more of a primary care, or is it like urgent care? Why would people come to Tanner Community Clinic?
Both,
Okay.
you know, because there is, you know, I have patients that I see on a regular basis, every 3 months, every 6 months, yearly for their, you know, their wellness exams, and then the urgent care visits, you know, like the sick, you know, hey, I've got this sore throat, urinary symptoms, all of that. So yes, it's an urgent primary care clinic. Yep, we see both.
So you're seeing a lot of these summer colds that we were talking about already.
I am.
Just a lot of sniffling, coughing, and not
Yes.
sure what's going on.
A lot of
something.
wheezing,
Yeah.
because of that, just the humidity and the dirt and everything that's being kicked around. This asthma, it's really affecting a lot of people's asthma right now.
Well, and I know in my family, they've been doing some farming or cutting the hay and
Yes.
getting skin irritants from it also. Some of the
Yes.
things that they're getting kicked up in, breaking them
Yes.
out. So,
Poison oak, poison ivy. I'm
Yes,
seeing a lot
yes,
of that. Because it is a clear oil and it gets on the skin, and it's you don't think that it's splattering while you're cutting it, and the next thing you know, you've got this itchy, fiery red rash on your body. So we're seeing a lot of poison oak, poison ivy too.
we were
So,
talking about that in the office the other day because somebody had gotten into something they didn't realize had
Yeah.
that oil and it had
Oh,
gotten
yeah.
on their clothes and then had continued to spread from there. And we were talking about that, how
Yeah.
my husband seems to get into that quite often.
Yeah. Yeah. Also, you see a lot of, yeast.
Yeah.
The kids are working out, you see it a lot in the young kids or the women, you see, so we treat yeast, on the skin. Heat rashes, at this time of the year, you can get a lot of heat rashes too. So, a lot of people will come in and be like, I've got this rash, and, they just want it checked out to make sure it's not something that's contagious or spreadable. So,
Well, and you've got a lot of athletes, and I know,
Yeah.
with the high school out there, they're doing football, they're doing basketball, and all of that.
That's awful.
And all now,
Yes.
and their
Yes.
sweat and their
Yeah.
pads and their helmets and things like that
Yeah.
that are causing issues too if they
Yes.
don't know how to properly take care of them or get them
Right.
cleaned or things like that. So,
Right.
So, what's your go-to advice for staying healthy in the summertime? Just overall wellness.
Well, rest, drinking plenty of fluids, the vitamin C, the multivitamins, hand washing. Hand washing, using your hand sanitizer, those are my big things. I preach that to my own family, so, and to the patients too. So,
and I struggle with the rest. Longer days means you stay up later
Yes.
and you stay outside working later, and
Yeah.
all of a sudden you realize it's 8 o'clock and you still haven't had dinner.
yes. So yeah, eating healthy, breast, water. People don't realize how much, water they lose being out in the sun and everything. So increasing that, drinking those electrolytes and stuff. So
Yeah. Well, thank you. We appreciate you coming and talking about this because, like I said, summer cold, already been there, done that, and
yeah,
hopefully don't have it again, but, taking care of our family members as well. So,
Yes,
and we
ma'am.
appreciate you being out at Tanner Community Clinics.
thank you.
Thank you. It was great talking to you.
Y'all too.
Thanks for joining us for this episode of Healthy Conversations. A big thank you to Tiffany Comer for sharing her knowledge and helping us better understand how to recognize the difference between a common virus and something that may need medical attention. Remember, not every sniffle needs a prescription, but knowing when to take action can make all the difference. Stay informed, listen to your body, and when in doubt, reach out to your healthcare provider. Thanks for tuning in, and we look forward to more healthy conversations.